Calls in Erie County schools are going to look a little bit different after the Erie County Health Department announced today that they would be adopting the state guidance rather than its own. State guidance says if students wearing masks are kept 3 feet apart, they are not considered to have been in close contact, so someone who tests positive, and they're therefore not subject to contact tracing.
However, county guidelines said that if there are 2 confirmed cases in a 10-day period in a classroom or on a bus, everyone in them goes home and into quarantine, whether they were masked or not, and even if they were vaccinated.
So what does it mean? Well, it could mean that fewer students will be sent home to quarantine and schools will not have to shut down. And good evening, everyone. I'm Scott Levin.
And I'm Mary Alice Demler. The rise in COVID outbreaks in schools is a concern for many districts and families. As doctors weigh in on the upcoming winter months, our Liz Lewin joins us from the newsroom with more on what that could mean for your child. Liz?
Hi, good evening, Scott and Mary Alice. Well, we've been listening closely to parents voice their concerns and questions about the rise in positive COVID cases locally here in schools and across the country. So I decided to reach out to a medical expert for some clarification. I also asked her about the impact other seasonal respiratory viruses like the flu might be having as well.
This virus is going to find anybody who's not vaccinated.
The rise in pediatric COVID cases is an ongoing concern. With more students in the classroom and flu season right around the corner, hospitals and medical experts are worried things are only going to get worse.
I mean, just think about it. Why would we not use something that we know works, that is safe?
For the first time since the start of the pandemic, the American Academy of Pediatrics reports kids now account for more than a quarter of new weekly COVID cases in the U.S. While kids 12 and up have a vaccine, the FDA has yet to approve one for younger kids, which is a big problem given the rise in school outbreaks.
No kid under 12 can be vaccinated yet. Now, hopefully that'll change within a month or two, but that's the problem. So that's a big pool of susceptible people, and particularly if their parents are not vaccinated.
Some pediatric hospitals are tight for space, and not just because of COVID. RSV cases are an issue, especially among younger patients, not to mention the flu, which doctors say will likely hit much harder this season.
We know that we're going to get flu. We haven't yet, but we have seen a summer surge in RSV, which can present symptoms somewhat similar to COVID. This is all symptomatically treated, but it does worry us, and we do expect that this will continue unless something dramatic happens.
So parents, what can you do to help keep your kids safe? Dr. Nielsen offers this advice.
If your kid is 12 or older, get that kid vaccinated with Pfizer tomorrow. And if your kid is under 12, make sure that you have a good attitude about them wearing masks.
Yeah, some really good advice there. Scott and Mary Alice, I asked for an update on pediatric cases here in Erie County. Dr. Nielsen says right now kids between the ages of 5 and 14 are driving the surge here. For more information, visit WGRZ.com right now. In the Information Center, Liz Lewin, Channel 2 News.